From the Oakland County Health Department, it is Shane Bies, the Administrator of Public Health Nursing Services, with us on the Oakland County MegaCast. Shane, thank you for being with us today.
Happy to be here.
How are you? How's your team at the Health Department been holding up?
We've been holding up. We've been busy, and things are continuing to evolve, and we continue to evolve with them. But there's been a lot of good work done and a lot more good work to get done.
New case numbers have been, over the last couple days, in the high 300s. I know that not this current 7-day period that just ended yesterday, but the previous 7-day period, it was right around 380. But not nearly as concerning as the 600-plus cases we were getting day by day, or right around that day by day, later on last week. Are things looking better now than maybe they were a few days ago in terms of these COVID-19 cases, or is there still a cause for concern that we're in a bit of a spike?
Short answer is there is still a cause for concern. It is good that statewide and in Oakland County, the last week or so, the numbers seem to have stabilized. But they've stabilized at a number that's a little higher than we'd like. Just for some comparison's sake, where we are with the cases, a daily average cases per million people, which is about averaging about 30 to 40 cases per million residency. So for Oakland County, that works out to about 50, 60, 70 cases a day. That was right about mid-March. That's where we were right about mid-March before things really took off. And that's the thing with COVID-19 and exponential growth. You don't see just how bad it is until it's just that bad. And so I think what you can see with these numbers kind of stabilizing over the last week, people are kind of realizing that, and we just need them to take a few extra steps so we can push down those case numbers and the positivity rate, which is also inched up a little bit from about 1% in Oakland County that we have been seeing to closer now to its 3%. That's a far cry from what you're seeing in states like Arizona, Texas, and Florida, but it's still the wrong direction. And so I just really want to encourage all your listeners and everybody that you can do. I heard you talking about a little bit beforehand. We should all, especially us parents, myself included, I got 3 kids, we should all be extremely motivated to do everything we can right now, wearing masks, still continue social distance. I haven't gotten a haircut for 5 months. To be able to get those kids back into school and help them get a good quality education and protect teachers and other staff for when there is school, hopefully. But we got to put in the work now. We can't put in the work at the end of August.
I'm not sure what your hair looked like before, but it still looks great right now. And I have to
Thanks.
say, though, as a parent and a healthcare professional, how are you trying to teach your kids the importance of having a mask on, and what advice do you give to other parents?
Well, my kids are 8, 10, and 12, and my wife and I, we lead by example. It's just something we do. If we got to take them in to someplace with us, we hand them their mask, we put on our mask, and we make sure that mask, as much as we're able to, is as comfortable for them as possible. Children and frankly adults aren't going to do something that isn't as convenient as it can be or isn't as comfortable as it can be. So if that means you just don't like wearing your mask because it doesn't fit right, or it's one that goes around the ears and doesn't tie behind the head, or vice versa, work to find one that does work for you, that you don't mind putting on, that you don't mind wearing it. But here's the thing, after you do it a few times, it gets to be habit. It's like putting on your watch in the morning when you're going out the door, you grab your watch. For me, or you put on a necklace, or you put on your mask. It's and once you get in that habit, you'll be walking into a building and you'll realize, oh, I forgot. Just because it's that habit, and you're like, I'm missing something.
So going into school in the fall, do you think it's better for kids to wear a mask, or what about those shield visors? Would that be a possibility? And which one do you think would be better for them, depending on their age, of course? I mean, high school kids are a little bit better trained and can follow direction more than elementary or junior high kids. So which one do you think would work better for them?
Really, really short answer is masks, hands down. While a face shield can help augment while you're wearing a mask, there's no substitution for a face shield instead of a mask. And that's just because the extra space around a face shield that can still allow way too much airflow exchange and potentially contaminating others if you happen to be sick or asymptomatic and be infectious. Now, when we talk about ages of kids, with some of the roadmap that the governor's laid out, they are looking at, kindergarten through fifth grade, not wearing masks while they're in a classroom. Now, while they're on a bus or while they're in the hallway, yes. And then all other grades, sixth grade and bigger, wearing masks. And there's some reasons behind that is when you have kindergartners and fifth graders in the classroom, you can more easily control where they are and what they're doing. And they're all going to be, generally speaking, in that same classroom all day long or around that same group of kids. Whereas sixth graders and above, they're mixing classes and they're going to and fro. And so and they're able to also, generally speaking, like you say, able to wear those masks more easily. And so while face shields, it's great to go in addition to a mask, they're not an appropriate substitution for a mask.
Shane Bies with us. He is the Administrator of Public Health Nursing Services at the Oakland County Health Department, with us on the Oakland County Megacast. And you hear a lot of skeptics about toward the mask wearing and is it even effective from a medical perspective. How effective is the mask in preventing the spread of the coronavirus to other people who are wearing masks, to other people that aren't wearing masks, as opposed to somebody that's not wearing a mask at all?
So one important concept that I want to make sure that we understand is that when we first started talking about masks, and I'm going to go all the way back into March and April, there was conversations, should people wear masks? What kind of mask should they wear? Is it worth doing it? There wasn't a lot of hard science that had been done prior to that. And there was this concept of, I am wearing a mask to protect myself. You talk about those medical grade masks, those N95s that you get fitted for, and that you make sure that if you're around people who are infectious, you at least are protected. Well, then there was this concept of, I am wearing a mask to protect others. And the amazing thing is that you don't have to have those N95 medical grade masks, and you don't have to be fitted for them. That the simple act of any kind of face covering, cotton, satin, just about anything that you can put over your face, that helps prevent those droplets spread, and it protects others from you. And then by others wearing a mask, they protect you from themselves. And we talk about habits. Michigan has one of the highest rates of any state. I think has been constantly ranked as number one or number two for people, the percentage of people wearing seatbelts. Upwards of 95+% of people in Michigan wear seatbelts consistently. And seatbelts do nothing to protect others. They protect you in the case of an accident. Well, what if seatbelts, by wearing a seatbelt, you could protect others in addition to yourself? And that's what masks are. Masks are a seatbelt that by simply just putting those on, whenever you go around other people, step into a store if you have to real quick, you could protect others and potentially save their lives. That is, I think, a very important concept that we need to kind of keep in mind, is that just like so many other safety things in society, masks are just one more of them.
Shane, there's been a program put in place in Oakland County. They're going to be helping schools in the fall put some nurses into various schools throughout the county. Is your department, being that you're in the public health nursing services, involved in that? What is that going to look like, and maybe how are those nurses going to be distributed in the fall to our schools?
Yeah, we're actively interviewing right now applicants, and I'd just like to put in a plug for that. If anybody's interested, anybody with an associate nursing degree or a bachelor's nursing degree, they can go to www.oakgov.com /jobs and can just search for school nursing, and they'll pop right up, and we'd appreciate their application. We've interviewed almost 60 applicants now, and we're making offers, and we're looking, and we're actively getting them hired on. And the idea is that these people, these nurses, will be an extension of the health division and go into school districts and be able to assist with them with their back to school plans and trying to help them answer all these questions and how to communicate and cooperate with the local health division, as school districts are required to do with the back to school safe roadmap from the governor.
Shifting just a little bit, obviously the focus has been on COVID-19, but the health department has other services. What do you want the general public to know about what your staff does on a day-to-day, and what advantages and what programs are for the general public to take advantage of?
Well, there's a few that I want to highlight specifically around this time of year that's particularly important, and one that's been critical since COVID-19 has started up, and even before then. So the first thing I want to mention is our Nurse on Call service. And that phone number is 1-800-848-5533. That's 1-800-848-5533. And we also have an email address at noc@oakgov.com. That stands for Nurse on Call. And we have many full-time public health nurses that are trained. They can help you get an appointment for a COVID test. They can help you sort out, what some of these executive orders mean. They can help you out with, if you're a parent and you have some concerns about back to school, they can talk to you about that. And they can also connect you with other community services. Even if we don't provide the service, we can connect you to so many in the community, because that's what our Nurse on Call does year round. And we have fielded literally tens of thousands of phone calls just surrounding COVID-19 since all this began. So I really want to encourage everybody to use that if they need to. But specifically, I also just want to highlight the fact of vaccines and vaccinations. Now, we don't have one for COVID-19 yet. We hopefully will sooner rather than later. And I know there's a lot of people that are a lot smarter than me. They're all working on that from a lot of different places. And so I'm really looking forward to when that is available, but it's not yet. However, there's a lot of vaccines that are, and unfortunately, due to COVID-19, there's a lot of children, specifically under the age of 2, who are not up to date on their vaccines. Somewhat understandable given all the shutdowns recently, but we've been encouraging physicians, and now we're trying to encourage parents to connect with their pediatricians and their family doctors to start getting their kids vaccinated, especially for back to school. The last thing we want to have to deal with is another vaccine preventable disease outbreak on top of the COVID-19 pandemic. And its vaccination rates are unfortunately down statewide. It's no different here in Oakland County. But there are catch-up schedules. You just got to work with your pediatrician on the most appropriate timing of those vaccines. And you can also make an appointment here with us, here in the health division, for that by calling Nurse on Call. And then when it comes time, which will be very soon, not just school-required vaccines, but also influenza vaccinations. We only have about 30-40% of Oakland County that gets vaccinated in any given year with an influenza vaccine. And we are just really encouraging everybody that when it's available, get vaccinated with your influenza vaccine. Is it perfect? No, it doesn't provide 100% coverage, but no vaccine does. But the more people that gets that vaccine, the less influenza activity we'll see, and the less morbidity, and the less disease, and the less potential negative consequences from influenza that we'll have to deal with again on top of COVID-19. So we want to help protect our healthcare system to respond to COVID-19, and one of those things we can do is by preventing disease and other illnesses from going into the hospital system.
Shane, is there anything else that you feel it's important to touch on today before we let you go?
I just really want to encourage everybody, again, think long term. Think right now what you can do, what small changes. It might not feel like a big deal, but what small changes you can do in your daily life to help limit the spread of COVID-19. Don't wait for it to get bad again. Do it right now and help us keep it where it is. Whether that's wearing a mask more often than you do, whether that's encouraging somebody, a family member perhaps, that should be wearing a mask more often than they do, ask them to wear that. And we want to get back out. We want to socialize more. And believe me, I really understand that. However, if there are some things that we can pause and we can delay getting, still such as a haircut sometimes, we should still try to be doing that. Don't throw those house parties. Don't congregate in large numbers. Still order carry out instead of maybe sitting down. That way you're still supporting, your local businesses. I've been ordering a lot of carry out from some of my favorite restaurants because I want to support them. But I haven't suggested to my family that we go in and sit down. The food is just as good in a carry out, and it lowers the risk for us to be exposed to COVID-19 or for us to expose those workers to COVID-19. So we just need to continue to do as many changes as we can to help lower that spread. Oh, I got to move around a little bit more.
Well, thank you.
Make sure my time lights don't go off.
That's all right. Thank you very much for being with us, Shane.
All right. I appreciate the time. Thank you so much.
Appreciate having you on. Shane Bies with us from the Oakland County Health Division.